Why do you think your state got hit so hard?
Our state peaked earlier than other states, than his state, than New York, than California. They certainly are seeing much higher infection rates, much higher hospitalization rates, and much higher deaths today than we are. And that's really how we've seen this virus spread across the country. What I'd like to know, Margaret, is why are you asking Cuomo these questions? Are you talking to Newsom about these questions?
When
and how
both of those governors accept an invitation to come on this program, and I hope they do, Madam, I really hope they say yes, and I really appreciate that you did to our invitation. So that's why I'm asking you about your state. They have not said yes. So for your state, you have, if you look at starting in July, which was after that spring peak, you have the highest death rate in cumulative COVID deaths per million in the country. The CDC says you have the 8th highest death rate per capita now. I'm not talking about infection rates. I know you're a conservative and you care about the sanctity of life. So how can you justify making decisions that put the health of your constituents at risk?
And those are questions that you should be asking every other governor in this country as well.
I'm asking you today,
Madam.
Madam.
South Dakota's in.
You're facing the nation.
I'm answering you, Margaret. I'm answering you. Regionally, we have seen the virus hit the country very differently, and it hit the Midwest earlier than it did the South, and now the East Coast and the West Coast. So we are still dealing with this virus in this country. South Dakota went through our highest rate of infections and implications earlier. The rest of the country is dealing with it much higher numbers today. And that's really what this means. What we should be looking at is, did the mitigation measures help? Did mandating different actions in each of these states make a difference? Because what we're seeing is that the mandates aren't necessarily what's working. It's that people have the ability, the flexibility to not just look at this virus and how it hits their health, but also how does it impact their well-being, their economic well-being, their ability to keep their kids in school, their ability to keep their businesses open.